in the field of DM, Clinical Immunology and Rheumatology in NEET SS 2021 session. Amazing.
Thank you, sir.
Congratulations. Wonderful interacting with you and talking to you today. And can we know, where you graduated from, where you're coming from, where is your native place, and where you did your post-graduation, and why do you want to do immunology, rheumatology, who inspired you, what are the events could bring you through all this process, because you need to have a strong desire to achieve something, and you had a strong desire to achieve rheumatology, immunology. That's the reason why I worked and achieved this. Can we know something about it?
Right, sir. Right, sir. So I'll start by saying that I did my MBBS and MD both from Medical College, Kolkata. So I'm from Kolkata myself. The city of Kolkata is the city of joy, what we know as.
City of tradition, city of tradition, city of culture, city of emotions, and city of city of football, and city of food, and and I know about that city very well, and I have loved, I have travelled enough. And we were in Raja Bajar Science College, Sham Bajar Metro Station. So I used to come for pre-PG classes, PG entrance exam classes. I used to travel to Calcutta and take classes.
Okay.
So I come to your college also for some classes, and but probably in different period of time.
Yeah, so the first 7-8 years of my medical education was in that college, Medical College Kolkata, which is the first medical college in Asia. And during my MD time, we had been kind of, have units in medicine. So fortunately, my unit specialized in rheumatology. And I slowly developed an interest in the field of rheumatology because I felt that medicine and rheumatology goes hand in hand. The same for all the branches, but especially for rheumatology, where you actually, tease out the diagnosis from lots of differentials and lots of mimics. We had a rheumatology dedicated clinic. We had a source of so many rheumatology patients visiting us every week, and especially lupus patients who have each of one of them had stories to tell, which influenced me a lot. And it somehow happened that I decided that if something I need to specialize in, this is going to be the branch. And my professors, my teachers were all very encouraging and motivating. And one of them did DM rheumatology from IPGMR, which is also in Kolkata. And he was a central figure in me getting inspired more and more. Finally, it happened so. And after I completed my MD, I got another wonderful opportunity to work as a senior resident in AIIMS Delhi. So that happened, and I took up the chance, and I was working there 1.5 years. And finally, I actually came in touch with speed in 2020, and I gave the exam then, sir. And my rank was 37. In between, there was a lot of close calls. And I gave PGI JIPMER. In between PGI, I was ranked 4. JIPMER, I was ranked 3. And NEET SS happened there. I was ranked 37. So I was a bit disappointed in the last NEET SS. But I kept on going, and I did give PGI this time also in the mid session, where I was ranked 2. I knew I was in the right path, but just kind of missing the bullseye somewhere.
What happened to PG rank 2?
PGI rank 2 was in mid session, sir. Then it was not any SS. So there was only one seat in PGI. Yeah, and it was one mark. So you can imagine how heartbreaking it was. But I felt that, yes, I need to keep on going. I love the subject, and I knew I was close. I kept hearing to your kind of speeches for us and words of wisdom for us. And here I am ending up with a rank 9 finally, landing up in my dream.
So the dream institute is going to have you, which is the dream.
Right, sir. Right, sir.
So all close calls, very close.
Very close, sir. Yeah.
You are there but not in.
Yes, sir.
So
Yes,
you're
sir.
very much there. People
But
say I'm very much there. So still a
right, sir.
little.
But you must learn from the mistakes. That's very important for future aspirants also. Like there must be something going wrong, whether it is rank 2 or whether it is rank 20 or whether it is rank 50. With each rank, you learn something. That's important. You won't always land up in the perfect spot. But what I felt was each exam taught me something. It was not only I gave the exam, came back and just waited for the results, but I took a lot of key take-home messages from each exam, sir. And I wrote them down so that I don't repeat it in the next one.
See, I'll tell you there is something fundamental background of this. You know what it is? The fundamental aspect of background of all this is this exercise from 2020 or just before 2020 till 2022, almost 2 years, right? And going across through all close calls. Now, in this process, you have finished one session of clinical immunology rheumatology course itself. You have not seen, you are not in the department, only that's the difference. You have not seen the clinical cases and not in touch with that particular specialty. If you would have been in an observer in any of that, that means you have completed one course of DM clinical immunology rheumatology. That means what? You already become one like that and you have learned all that to be learned. And the subject that you have learned is an exit level of a DM clinical immunology rheumatology. That's the knowledge right now you have with you. Yes, that's what this exam also demands. And if this exam, if it demands that, and you have to deliver it, and for that you are undergoing all that, or no matter of fact you need to read Kelly's, or no matter of fact you need to go to that guidelines and to know the very precise things to get into all that. So what happens is now you have learnt all that, and you have become a rheumatologist and clinical immunologist and rheumatologist by now, and as you join the course from now on, you see patients, it will perfectly match.
I think so, sir.
So
Yes.
what happens is you have become a book now. See, that's how we need to understand. You have become a book. So what was external, you have imbibed and have put inside. So now you are a book by itself, and you are the reference, you are the book, everything is now inside here. And now what happens is whenever you see, there is straight up direct application. So what an wonder! What an wonder! Now you see patient, then you have to go back and you need to read. You will not be able to read. When you go back, you will feel like sleeping. The only thing that you will do is go hospital, come back and sleep. Nothing else. You can't even open the book. See, when I did cardiothoracic surgery, the first day I purchased all the textbook, super specialty books. You know, when I opened 15 days before the third year of exam. The exam will be on end of third year, no?
Okay.
And they will give 15 days study holidays. We all opened only at that point of time. Few of my colleagues purchased the book only at that point of time. Because there will not be even a minute be spared during your clinical practice, and that's how it has to be. That means your patient is your book.
Absolutely. Absolutely.
And sorry, I have taken a little more time from you. And generally, I don't do that in an interview. I always listen to people. But unfortunately, because you brought this point, what I'm trying to tell you, in fact, is this 2 years or 2.5 years, the time that you have invested, yes, for your rank and to get into the seat is not even a single minute is a waste. That I am trying to put it across, and also for those people who have worked for 2.5 years, still not got one to work for 1 more year also. This is an investment. It's an investment, and it is never treat this as a waste of time.
Right. Right. And more so, sir, with the evolving pattern that is coming in the next few months, and this new pattern that is going to be there, I would ask all the future aspirants not to get panicked, because I always felt that we should treat the exam hall as an emergency duty room. When we are posted in an emergency duty, we don't know what kind of patient will come to us next. We are ready for anything. That's how we are trained during the MBBS, during the MD. And that should be the attitude when we go into the exam also. Finally, I realized it took time, but finally I realized that if you kind of go into an exam hall expecting a pattern of questions or expecting a pattern of things happening, then you will most of the times turn out disappointed and have a lot of complaints about it. But instead, if you go into that room expecting that you might get anything and everything, and you have to do your best out of that. You won't always save every patient that comes into the emergency room, but you do your best. That's what you can do with the set of skills that you have at that point. Same thing is with these exams, sir. So for all the future aspirants, whatever the pattern may be, whatever the question may be, don't keep any expectations that this will come and I will do this. Better to go with an open mind and put all the knowledge which you have gathered, apply it and on that day and do your best, give your best.
Absolutely, absolutely. You are talking through your experience. My goodness. What information. I'll tell you. See, for those who are viewing this video, I am telling you what he means. He means consume the knowledge, acquire the knowledge, have with you. When they ask you the question, when they ask a question, see that a patient is standing in front of you and use your wisdom how you act for it. That's what he says. Am I right? So you make that way. So if you can't understand what he said, this is what he is saying. So absolutely, the upcoming exam, you will not know which standard it is. To my prediction, it will not be within Harrison. That is, I am 100% sure. And I will tell you, you think that they are given a PG standard exit level and they have made you happy. No, they are not making you happy. Understand, they have, what was a specialty exam, they have made a multi-specialty exam today. It is going to be neurology, it is going to be hematology, it is going to be rheumatology. So it has become a Pandora box. It's opened big. That means they also want you to think big. I mean, as a whole, I mean, a broader perspective. Correct? Yes. Am I right? What do you think about it?
Absolutely.
With a kind of a factual knowledge, you cannot touch the question paper. From now on, what you need to have is a broader perspective and an approach of a patient. Then with that, what you will do? Probably that could be, I think so, in my prediction, I think so, and I leave it to you. And I'm just interrupting a lot. I'm sorry. Keep going.
Yes, and this exactly what happened when I went through the speed app. I would come to it because actually the speed questions which were there predicted this pattern a long back. So it always gave this kind of not only one-liners. One-liners are a age-old pattern. It's not going to happen anymore. So most of the questions in speed app was about this pattern, giving a set of scenarios and what to do next. A very realistic approach, which is actually needed, and the pattern will evolve more and more. This time it might include images as well as some data points and some questions according to the scenario. So the speed app helped me not only learn about things, but how to apply them. That is very important. Just accumulating knowledge over and over again through a set of predetermined kind of course is not going to help in the long run unless you apply it. So that's where the speed questions came in, sir. I saw the classes. Sometimes I was not able to attend all the live classes, but I saw all the recorded sessions. I didn't miss any of them. And then I solved the papers. And when you give an exam, it has to be given very seriously. You just cannot go about it casually, because you have to take every exam seriously. You need to be thorough with the set of questions that's given to you, and you learn more from your mistakes than the number of your corrects. So when you are doing a certain number of correct questions right every time, you only look at the total score, sir. But I would like to see who are going to appear in the next exams, learn more from your mistakes. Where are you going wrong and why are you going wrong? What is wrong happening with those questions exactly? And write them down and try to solve as many different types of questions as possible. That's important. And have a visual memory built up. The more questions you solve, the more classes you see. Use every part of your cortex wisely. Not only the auditory, not only the visual. Use every part of it in a nice way.
Exactly. What you said is exactly. See, as you gave the NEET, then subsequently you gave AIMS and PGI, then subsequently again you gave Mid PGI, then subsequently you gave NESS. Now you are given. With all that exams, as we give, the exam questions are changing very rapidly. The stability is not there. One exam different. Next PGI is not the same as previous PGI. AIMS is not same as the previous AIMS. This NEET was not same as the next NEET. So what we were doing is, people may not understand. I'm telling you today because it came to the topic. When you gave NEET SS, then we had a pattern similar to that. When you gave the subsequent exam as you went on, for rheumatology I'm talking about, the pattern changed. Then again I have to introduce a new course. And then the course has to be for that range. And when that course, so there are 5-6 courses which are there in the app actually.
Yes, sir. Yes, sir.
I mean, people understand what these are fools. Why they have given so many courses? I said, I mean, how will I explain to you? Because these are ages. This is a chronology. See, that exam was that. So preparation, that age of students will read that. And next exam from there would have started. From there they will read. So it is how one could fit what they want depending on the knowledge base they have and what is the requirement. That module will match them. So that's how internally we mapped. And even today, I will tell you, after this exam, we are again starting a course. Because already a lot of things are there. There is no purpose for us to do so. But why we are doing it is because for next exam, what prediction is? How to move forward next to it. And
Yes,
if I find you as a great resource person, and after the interview I'll call you tomorrow. Excuse me, you have prepared all that. Come on, come on and take class.
right, sir. Right, sir. It will be an honor, but that's what it will be an honor, sir. Anytime.
Sure, you would have prepared bunch of material. I know. Now we will utilize your resources because you are recently done. Yes. Can you go ahead, doctor? What is your message? What do you want to give to the students? What do you want to tell them?
So I want to give to the students that always be a student first. Like, don't think yourself as like a super specialist. You are appearing for a super specialty exam. It's all right, but you have to be a student first. Be very humble with your knowledge. Be very humble with your approach. And it's a marathon. It's not a sprint. It will take time. Be patient. Persevere in your efforts. Have faith in your dreams, and learn from your mistakes. That's very important. And don't give up. When you see something not going right, that means something better is definitely awaiting for you. And as you said, sir, recently, don't settle for less. That's very important.
You saw the video, huh? You saw the video.
Yes, sir. Yes, sir. And try to come out of the denial phase as soon as possible. Accept the facts, whatever it is, because time is money in this game. And you have to move on so that you can reach your true potential. That's all I want to say, sir.
Very, very, very true. What you said is 100%. 100% I accept it. And this interview is mind-blowing. Very much needed, and people should see this interview. Sure.
Thank you, sir.
You are amazing, yeah. You are amazing.
Thank you, sir. I wanted to talk to you for a long time. It's an honor.
Mental arithmetics, my God. Superb.
Yes, yes. It's all a mind game.
Mind game. I mean, where did you school? Schooling? Where? Which place you studied? Like school? Where? Which school is it?
I was schooled in Kolkata.
Name of the school? Name of the school?
I was in St. Thomas Church, sir. It was a Catholic school, and the fathers actually taught us the virtue of patience, perseverance, and to stay humble, most importantly. That will make you go a long way, because not to be too overconfident and not to be underconfident. Keep a balance. Whenever you see a question, even if you know the question, read it again. That's important. Even if you don't know the question, read it again. That both ways it will help you, sir. That's one thing, that to be humble and to be honest with your efforts. Rest will fall in place.
Great. Very good. Excellent. So time to thank. And whomever you feel that your heart says, not your mind says, that to say thanks, you can go and whatever time you want, you take it and you can do so.
I would like to thank my patients, sir, because I got this motivation of doing rheumatology as a specialty. I consider this as a subspecialty because I always feel medicine is the mother branch. If you don't know medicine, you know nothing. Rheumatology is just an extension. So my patients who taught me in the wards, in the OPDs, in the clinics are my motivation, and they are the ones who brought me here. All the lupus patients, all the other patients who had some ailment, who came to us in their times of need, my teachers who actually brought out the what we didn't saw in ourselves, they pointed out, and that's how we get to know that yes, we can reach somewhere. My parents, as I said, without them, nothing. Without their blessings, my parents, my elders, my family, and my wife, who was a rock while I was preparing. So you need to have a good support system, and of course, speed and your wise words. Without support system, sir, nothing. Even if you are a genius, you can't achieve anything. At the end of the day, you need a support system to thrive through. And I would like to thank all of these people, and I hope I do justice to my field in the future.
Excellent. Wonderful. Dear doctor, I wish you all the best, all the success, and a great career ahead in clinical immunology and rheumatology, your dream branch, and you want to look yourself in that brand, the brand of rheumatology and immunology, and that's what you want to live in. And definitely you will contribute a lot to your specialty, and you will definitely give a great service to the patient who come to you, and you will touch upon millions of life, and it's a great career, and all this is going to happen in future. And as it happens, and I don't know whether I'll be able to personally congratulate you at the point of time. For that, my advanced wishes, advanced congratulations, and to have a great career and life ahead, and definitely you will do so. I'm very confident about it. Best wishes to you.
Thank you, sir, and do come to Kolkata whenever possible. We are all waiting for you.
Sure, 100%. I'll be there. Thank you.
Thank you, sir.